A family had mourned once again, watching a native waste away in a bush of thorns, trying to give birth, leaving behind lovely twins. This is just one of the several cases that we must wake up to curb. The World Health Organization has it that every day in 2015, about 830 women died due to complications of pregnancy and childbirth in the world. Of the 830 daily maternal deaths, 550 occurred in sub-Saharan Africa and 180 in Southern Asia, compared to 5 in developed countries. It is estimated by the World Health Organization that in the year 2015, 814 women died for every 100,000 live births in Nigeria. There are those who have risen to the challenges of inadequate maternal health care and basic amenities by extending a helping hand to rural dwellers. Building primary health care centers, sinking boreholes in collaboration with the communities, giving scholarships and empowering the poor in these communities. They have broken limits and defiled terrains in an attempt to provide basic primary health care to rural communities in Ebonyi State. Ananda Marga Universal Relief Team Amurt is a private international voluntary organization founded in India in 1965. Its original objective was to help meet the needs of people after disaster. However, over the years, it has expanded its mission by also improving the quality of life of the poor and those affected by conflict and calamity all over the world. They are in 34 countries in the world. In the year 2010, Amurt extended its humanitarian reach to Nigeria, and its first project area was Ebonyi State in southeastern Nigeria. Known as the Salt of the Nation, Ebonyi State, with a population of over 2 million people, was created on 1st October 1996 with Abakaliki as its capital.
I would say that Amurt has enjoyed very good cordial working relationship with Ebonyi State government, and we are quite pleased with the activities in Ebonyi State. They have supported our people in very many ways, and most especially is that they render their quality services in the hard-to-reach areas, in the very remote areas of Ebonyi State. And they have supported primary health care in those areas. And the model they have is very, very good because they have partnership with the community. So the community ownership and participation is high. And they also render emergency services. They also train middle-level manpower and even give scholarship for them to train outside the community where they are working. So they have a lot of packages, even water. They go into the areas of borehole drilling, which they call the washcom. And they have a committee with the community so that the community decides where they site the borehole and they partner with them very well, and they have a very good memorandum of understanding with the Ebonyi State government through my ministry. Impacted positively, especially in the healthcare delivery of our state, because they've helped to assisted to reduce the maternal mortality in those areas where they function, and their facilities are quite standard, and I've had opportunity of visiting, and people are very happy with them. They conduct deliveries, they treat all kinds of cases, and the ones that they cannot manage, they refer, because they have even ambulance services to refer cases to the cities and the higher institutions. When I was appointed as Commissioner for Health, there was ongoing cholera epidemic in Ebonyi State that involved 38 communities and 11 local government areas of Ebonyi State. It was just moving from one community to another, and Amurt was noticed to be doing a lot. They did a lot, they supported us, and even on their own supplied drugs, undertook treatment of some of them, and saved many lives. So we were happy with what the activities.
The model that Amurt has adopted is very much in line with the ward health system introduced by the federal government of Nigeria in 2007. It's a partnership where the community is at the center. The way we do it is that we go to the very remote areas where there is no access to health center, where the distance to the nearest health center is very long. And then we look for those communities that have a commitment, a readiness to invest themselves in the construction of the health centers. That means that they feel that the health center is the strongest priority for their community. The model is a health center that is community owned and that is community managed. In the course of the construction, the community provides all the labor, and also, according to the capacity in the particular area, they provide sand, gravel, and also wood. The government comes in with the employment of the health centers and also other kinds of support and supervision. The role of Amurt in this model is to help to provide means for the construction, the materials for the construction. And we provide opening inventory of all supplies and drugs. Then that inventory or the supplies of drugs will be maintained by the management committee through a revolving drug fund. They put a surcharge or a markup rather of 30% on all the drugs and all the supplies, and then they restock. And Amurt also provides furniture and equipment, and then the community will maintain it. They will do the repairs if anything breaks down. Also for the facilities, the community, they will save money in the bank so that they can do the maintenance, and they can also do the repairs. And in some cases, in some of the health centers where we work, they have also been able to save money for new construction and expansion. Also, the community management committee are able to pay for all the main running expenses of the health centers. Amurt also helps to provide additional support, financial support, for outreach and health education. This also includes training and capacity building in the communities. Now, because of the level that we feel that is necessary to run these health centers, we need to recruit additional staff. So for this, we look for unemployed qualified health workers in the local area, in the community. And we've had a very good experience with this, to recruit health workers from the local community, because it makes them more likely for them to always be at work and to be able to communicate and relate with the local population. We also recruit some traditional birth attendants, those who are trainable, those who are young and trainable, who are able to become an asset there. And we've had good experience in doing that. We also recruit trainees. That means those with little or no experience that can be like auxiliary staff. And we have discovered many jewels of them. And the most talented and most committed of them, we assist them to further their education, so that some of them have also entered the School of Health on Amurt scholarship.
Amurt introduced a system where the people themselves they are serving are operating the health facility themselves and not Amurt. All the inputs they're giving there, the people are managing it for themselves. The account is not even, the Amurt is not even a signatory to the account. They sign for whatever they want to buy and they put their money and buy what the consumables they want to use in their health facilities. But Amurt is like a God sent to save our people. Even I had met with my local government chairman. I've introduced what Amurt is doing to them. I've told him that if they can discuss with Amurt and copy their model, it will be the best for the local government, that the state will eventually be learning from us. But as you have said now, it's good to say that the state should adopt Amurt model also. The model is a system where the issue of that somebody go to health facility and there's no staff there is not for them. And the issue of drug revolving is also welcomed. The issue of using indigenes, because most of the time we discover that you post a staff to, in fact, because Abakaliki local government, if you are outside, you will think it's an urban local government. But the urban is not up to 5% of the local government. So greater percentage is living at the hinterland. And most of the staff are residing in the urban here because there were no amenities up there, like water, even access roads sometimes is difficult, and light. And so if government can now, because Amurt provided light there, they provided the ambulance, they provided the water for their staff. So if government can emulate the Amurt model to ensure, then people will be ensured that if they are staying there, they will be taken care of. One, mosquito won't be there because the house is of a standard. They will have access to water, they have access to light. If the government can do that, the better. And if it is a referral, they are perfect. They don't waste time, and that's why they are saving greater percentage of our women and those that are sick. The Amurt people are here. They can also tell us what they are, because they are even expanding to various local governments now, and they are always readily available to even give their own input so that state can do their line.
We're interested in saving the woman and the child. That's want to reduce maternal death and newborn death to the nearest minimum. And when you look at maternal death, we are talking about when a pregnant woman dies, or when a woman dies in the process of giving birth, or when a woman dies after or within 42 days of delivery. And these deaths could be due to the pregnancy itself, or maybe due to another medical illness. This thing happens, we can say that there is maternal death. And in our work, from our experience, we've looked at the common causes of, or the factors that may put a woman to, at risk of dying more than others. So in rural communities where we operate more, we look at their level of literacy, how literate are they. We look at the level of poverty. We look at accessibility to health care.
Here in Nigeria, we are only so far in Ebonyi State, and our focus is on primary health care, maternal health, and also water and sanitation. When you want to focus on maternal health, naturally you have to see how you can extend healthcare services into the remote areas, those areas that are not covered, where the population has no access to health services. So our goals in Ebonyi State is to reduce maternal mortality and newborn mortality. When we came to Ebonyi State in 2010, we started work in Ebonyi Development Center in Abakaliki local government area. There, in partnership with ActionAid and the local government, we were able to start 3 health centers in Melaina, in Efenium, and in Ofioji. Then in 2012 we came to Ikwu. We're working in an area called Okputimo, which is in Endufu Ikwu Development Center, and here we helped to build 2 health centers, one in Elugo Etam, where we are right now, and one in Odeligbo. Actually, in Odeligbo, the local community provided an old town hall that was totally renovated and made into a health center. Then we came to Oauku local government in 2014, and in April last year, in 2015, we opened a health center. It was constructed by the community in Akparata.
As far as health is concerned, that clinic at Akparata there has saved a lot of lives. Women who are about delivering and they find it very difficult. They have been saved from, dying by taking them in ambulance from that place to Abakaliki for treatment, and they have survived many lives through that method.
And now we are working on the construction on a second health center in Effium, actually in Inikri Effium in Oauku local government. So that's the areas where we are in so far in Ebonyi State.
At Ofioji Health Center, one of the health centers that is being run by Amurt, and of course today happens to coincidentally be their antenatal day. And you can see seated behind me women who have come for the antenatal clinic to get care. This is one of the mission of Amurt, to bring maternal health to the people in the rural areas.
Ya ebe a nnọọ nwere nwana di m bịara ebe a bịa hụ na ọrụ na-arụ n'ebe a dị mma, ọ sị m ka m bịa ebe a n'ebe a na m bịa ebe a m ga-enweta onwe m ọfụma, so nnọọ ya ka m jiri bịa kịta keletegodi m. Nke a bụ mbụ mvụ ụzọ bịa ebe a ga-afụtarịa bebele ọdụ ma mbe kan ntamata ruo ka ma dị jiri ejiji andụle. We come
this area or the project area and we conduct antenatal services to the women. And what we actually do is comprehensive antenatal care. As you can see, if a woman comes in for antenatal, we register the woman and then take the vital signs of the woman. Then the woman moves to the doctor for basic clinical investigations, and after examination, they will send the woman to the laboratory for basic routine investigations. And when the woman got done with the investigation, she comes back for ultrasound scan from the doctor. And actually, the scan is free. We don't collect money from them. It's free, and it has helped us a lot.
We do routine antenatal tests for pregnant women that come to our center at their booking, because that's the first time they are coming. So this routine test includes urine screening and then blood tests. In urine, we check for protein, glucose, and then blood. In the presence of blood in urine will indicate infection. Then protein indicates there might be chances of preeclampsia. And then glucose indicate gestational diabetes, which is suffered by most pregnant women. So when we indicate those things, we now have the doctor and the midwife to handle the women and make sure that they deliver the baby safely.
Since Amurt came in this community, they has helped us a lot. They helped us, this free delivering, they bring it to us, borehole, they bring it to us in quantity numbers of it. This health center, they are the people equipped this hospital and servicing the hospital, looking after the people working in this hospital. They give us a toilet for the hospital to be using. They give us quarters for the staffs. They give us in education in how to manage ourselves. Women's that pregnancy, if you see this sound here, there was nothing like this before, but now there are numbers, quantity numbers here. They are waiting for their internet. They came for the antenatal. It is the Amurt effort bring all those things.
I work as a health education and a family planning coordinator here in Amurt. So Amurt has a vision, and we've been going through the vision, which has to do greatly with reproductive health of the women, you know, their safety and the safety of their babies. So but we've discovered that along the line, most of the women, their parity is quite high. Some of them have up to, let me say, 14 pregnancies, 15 pregnancies. And when you ask them, they tell them it all depends on their husband, on God, because God gives, and that the babies in the womb of the woman never finishes. They have different reasons why they say what they say. So but along the line, we discovered that if we don't help these women, then they'll continue to be in trouble. So most of the things they know about child spacing is its misconception. They just believe when you use it, you have tied up your womb, you can't have a baby, and when you can't have a baby in your next generation, in your next world, you won't be pregnant again. So they are so scared of it. But from the help of Amurt, we've been able to talk to them, to make them see reasons why family planning or child spacing is very good. So they've come to understand that by child spacing, the women, after they've delivered, they have enough time to become strong again. They have enough time to take care of their babies. So when we talk to them, we teach them that it's good for a woman to take maybe a year plus or 2 years to work, to take care of her kids, to become herself, have a time to rethink, think about your life, think on how to take care of your husband, because your job is not just having babies. So with this, there have been improvements.
High-risk pregnancies are those pregnancies that are associated with some conditions that may put the woman or the baby in the womb at risk.
The doctor sees them, and if the doctor discovers that any of them has any problem that will likely lead to complications during delivery, now the doctor captures them in what we call the high-risk pregnant women register. So when he captures them there, then he will inform me to go to the high-risk register and then see the names written there, then through which I will get to know who and who is a high-risk pregnant woman. Then from there, I will get a card Amurt provided. It's called high-risk pregnant women card. It's a pink card. So we use this card to collect the data of all the high-risk pregnant women as may be written in the high-risk register. And then we'll have 3 targeted home visits for these pregnant women identified. Because the reason for this visit is to actually, reduce the rate of maternal and child mortality or morbidity in Ebonyi State. So because of this, Amurt have carved this program that we should be visiting these high-risk pregnant women, try to bring them to the facilities.
As OIC, I supervise every activities in the health center. Most of our workers, even I particularly myself, I am the member of this community. Most of our staff are the member of this community. So as we are working with the local recruitment, whom the community members know very well, they are very much happy. The action aid came here before Amurt, but action aid left here, Amurt came in. Then as Amurt came in, everything started in fullness. Amurt is the organization that equipped the building, equipped the health facility entirely. They bought drug and then tell us that we should revolve the drug. In case it finished, we should use the money we generated from the drug, we should use it to buy another drug. Then any remnant of the money, that is why the account was open, so that as it remains, go to the account and put it, so that with that, the health center will be sustained.
In the MYE department, we have a database that we use in tracking our work. Most of the things we track include deliveries, both at the health center and at home. ANC, both new bookings and revisits. We track referrals. We track high-risk cases. We track mortalities. We track HIV. We track laboratory investigations. And those laboratory investigations will track majorly hepatitis B virus, hepatitis C, VDRL, and HIV.
Amurt is running free delivery services in all its supported facilities in the state since 2014.
Amurt came to Ebonyi State in 2010, and their coming into Ebonyi State was a blessing to us. For 1 year where I worked as a head of health facility, there was no single delivery. But as soon as Amurt came, we started moving from one house to the other, using health education and sensitization.
Here we perform 2 basic roles, accounting roles and general administrative duties here. We take part in budget plans for the year. We post our daily tickets, our daily receipts, our daily transactions through our accounting software, QuickBooks. We monitor all the funds that we receive from our donors. Then we also conduct our monthly reconciliations.
I'm in charge of management committee in all the health centers we have. And the management committee, they are the representatives of the community.
Village. Maka ahota lobodo, ahota le hug, ahota le ndalo, ahota le uncheg, and the 7, ahota le walakad, ahore commission modo on the village modo manage committee, and the 6. And they got into the robo on wab, and I may check on. I go meta, I go with my expenses, or I go where you solve. Stalin the management committee about to take a coach leka, get might be Dracore move, gas off for corrupt takode. Like doctor, I know what I in the rate so your blade jan, got a casual of day maybe, and they had a bonobundi shine. I think I better a number share and you have pack of bolus so the antapocados or dead. Management committee about the management committee.
Meet with the maternal health promoters whose work is to identify every pregnant woman in the villages, make them come for support group meeting where they are being taught best practices during pregnancy and encouraged to come for ANC at the health center and possibly give birth at the health center. The maternal health promoters are doing a lot. They are like the eyes of the hospital in the community. We are keeping track of every pregnant woman through them. They monitor them, they encourage them to come to health center for delivery. Actually, this was born out of the desire to fill the gap between what they know and what they do not know.
This economic empowerment program, we started it as a result of when we find out that there are women that we are unable to pay their hospital bill. So we now find out that it's not good to be giving people fish. It's better we teach them how to get fish, catch fish. So we started a kind of pilot study to see how well it will go to empower these women to take care of themselves and their family. And these women are basically widows. Some of them are indigent.
Eva mobo sisilo karaka. Business mobo ashove. E kanchi nweta kobongu de miabule e kando Amurt. And ebe osule okoro iye taranye kambo wokoka. Bo nda Amurt. And business and le mela gali huakari. Obibe hoto doranye since take beshi ebe norianye. Ane kele shivike. Ebe mera nwere homa karia doge anyishi dole teke te shidonianye.
We are in Azugu Eka
Onweke in a North local government area of Ebonyi State, where of course as part of Amurt's water and sanitation initiative, today the community is being sensitized on the need for having a proper sanitation, the essence and importance of having a clean source of drinking water, and of course the avoidance of open defecation. Now all of this is very important to this community because of course it was one of the communities that was affected by the last cholera outbreak in the state. Now they have come out in their numbers. I'm talking men, women, even children are here. So before now, what was the primary source of water for this community?
Basically, we source water from pond, streams, and even river. We thank the government of Ebonyi State, particularly using Amurt as a non-government organization to extend their good work to us.
Have been partnering with the local government in Ebonyi State in providing potable drinking water, hand pump, borehole. So how they do it is that there is matching fund with the local government, whereby Amurt we pay for at least maybe 5 boreholes. The local government will pay for 5 boreholes. Then from the community there is counterpart fund, 5% of the normal the money that should be used in drilling the borehole.
So the Amurt people dug many boreholes for us and they repaired the damaged ones.
It's a myth, really, that healthcare in the rural areas can be 100% sustainable. It needs to be subsidized, but you can attain a level of sustainability by strengthening the local community management, so that at least basic operating expenses, restock of all drugs and supplies, maintenance and repairs, all these things can be managed by the health facility itself.
Amurt are able to go up and save Nigeria, to promote Amurt program in the world. Though the ignorant may say it is nothing, but as Amurt we know is good. So support Amurt program, support Amurt program, support Amurt program today. Everybody support Amurt program, support Amurt program, support Amurt program today.